Hi everyone, welcome to Paragon Perspectives, or as we like to call it, come shrink and drink with us. Today we're talking about ADHD, highly topical, everyone's talking about it. Who hasn't heard? Why is everyone suddenly ADHD? I think they think that everyone's watched TikTok and they've self-diagnosed. It's not the case, guys. I want to start off by saying what's really interesting in South Australia is that as of July next year, you will not have to go to a psychiatrist and try to source one to get a diagnosis. So there are going to be GPs who have done the training to do this, and they'll be the ones that you can approach. You can still see a psychiatrist, but you don't have to. And I'm going to suggest that those like us who really like working in this space will be working closely with these GPs. So this is a bit exciting for us anyway. Today we're going to talk a little bit about ADHD in general, how some of us are ADHD ourselves, how some of us are the furthest away from ADHD humanly possible, how this relates to the work that we do. And I'd like to start off by saying that I'm ADHD, and I only realised I was ADHD about 3 years ago. Looking back on it, a lot of the things that I do speak to ADHD, but I'd never had this kind of insight because I thought the rest of the world operated like I did. If you look at your clinico diary for your patients, guys, your clients, it's an ADHD diary. So I designed it so every type of different client has a different colour. So when I look at it, I know immediately what I'm seeing and how I'm seeing it. That kind of helps sort my ADHD brain. I couldn't handle it before it became electronic, where it would be paper and it would just be people's names, and I'd look at it and become always a little bit, oh my God, a bit overwhelmed. Whereas now I look at it and it just goes click, click, click into shape for me. And I think you guys like it too because it makes sense. But for me, it doesn't make sense. I need it. It's an option, it's a necessity. And so I think therein lies the difference. I think my partner would say I was ADHD. Would he say that without realising I was ADHD? No, I think he would think I just kept interrupting him all the time. But that's also one of the ADHD kind of symptoms. What do you guys do? When you get a client who's ADHD, can you see them walking in and just after 10 minutes you're like, yep, I know what's going on here?
I think normally it's when the sessions run 10 minutes past time that I'm aware.
Or when we started somewhere and then without even realising we're like 10 topics past where we started, and I don't even know how we got there, but we're just here. I have to go, we've now gotten to, like your workplace from 10 years ago when we started with what's your name and why are you here? And you go, oh my God, how did we get here?
See, which is really interesting because having an ADHD brain myself, when I'm talking to an ADHD client and they start to bounce, I actually bounce with them. And so they look at me and go, oh, sorry. I go, why? And they go, because I go, that's fine, I'm sticking with you, I'm on your tail. And I go, really? And I go, yeah. And they go, that's fantastic. And they're really, really excited. And when I have a non-ADHD person and we're very linear, I'm like, what's going on? Can we not deviate? So it is interesting in that respect. Chris, what do you think?
I'm always surprised. I think sometimes people have their tells, but then I've got friends as well where some of them got diagnosed and it's like, oh, it makes sense. I mean, they've obviously had that light bulb moment, but I think we were talking about it earlier, where a lot of people that get diagnosed late in life have previously been diagnosed with things like depression and anxiety. And there's a lot of kind of overlap in the presentations of those sorts of things. Like, I think, like social anxiety, right? Like people that have certain types of ADHD can be overwhelmed by social situations because of kind of the cognitive demands as opposed to like the more social anxiety aspect of it. And so there's, I think it is worth, with the psychologist, there's that exploration of, okay, what has my past sort of meant and why have those things happened? I think a lot of people get labelled as, oh, you're just anxious, or you're just a bit depressed. Or
I would hope that I'm sure here that most psychologists now, when you do get somebody who presents with, or a referral that says depression or anxiety, that I never take that at face value.
No, that's right.
That actually immediately my brain goes, what else might sit underneath that? And that can often be, misdiagnosed ADHD.
Or borderline personality disorder, which is a very prevalent diagnosis, almost a catch-all, especially the GP's making, where it's like, oh, there's weird shit happening, you're BPD. And then we get them and we're like, actually they don't fit the profile. But they're very justice sensitive, and they've got to make things right. And when you don't do things right, you're dead to me. That's not a borderline personality. That's like very justice sensitive, And I think once you explain that to clients, there's almost this, God, that makes sense.
Makes so much sense.
Makes so much sense. And, hoarding and collecting all the fabric on the planet because at some stage you're going to make something.
Yeah.
And it's like, you don't need 3 rooms for fabric. They're like, oh, well, is that why I did it? But I used to be a nurse. I was brilliant at it. Yes, because you're hyper-focused as a nurse.
Yeah.
But at home, you're like, oh, shiny thing, let me collect some. Oh, look at that online. I'll buy 3 meters of this. I'll use it at some stage.
Yeah, and I think that's an interesting point with a lot of it, like sort of what I've seen with ADHD is people manage to cope. People find ways to deal with it. And for some people it takes up until that point where they can no longer cope that things fall apart, and that's when they seek help. It's not kind of a recognition early on. They fly under the radar for various reasons, and then I don't know, they start a new job and they've got all these other things going on in their life, and it just becomes too much, and then you're depressed or you're anxious, and then if you find the right sort of practitioner to work with, they can sort of gently nudge you in the right direction of sort of understanding what that looks like. But I think for everyone it's different.
But it is interesting. I've found something just in the last, I reckon, 3 months. I've had a few people come and see me who I've been working with, and they're youngsters, 15 to 18. And it's pretty obvious to me pretty soon that they are on the ADHD, spectrum. And when you talk to them, you start to get a feeling for it, and then you do some testing, and yes, they are. Their parents then don't believe they are, and neither does the GP. And this particular client of mine, when she came to see me, and she's only 15, she admitted to being overwhelmed and starting to cut, but she didn't want me to tell her parents because she was not doing it anymore. And she went to her GP with a letter from me saying, this is what I think you have. And the GP looked at her and said, no, we can hold a conversation, you're fine. And, it was very invalidating for her to hear that. And the mother was like, the GP's right, because she didn't want to hear that the child had ADHD. Even though she said to me, I'm 100% sure my father has too. And it's very genetic, so most probably. But what was really interesting is that the people where they're invalidated are generally very bright kids who are doing really well and getting straight A's, so they can't have ADHD, but they start to get wobbly at about year 11. Because intelligence then isn't enough. They actually have to have structure and organisation, and they fall apart at uni.
I think it's worthwhile mentioning that the diagnostic criteria for ADHD was very much based off of young boys who are traditionally more
motor.
It's observable. They are the class clowns. And it's a little bit more accepted as well. Like you are disruptive, and you can be because you're a boy, but for younger girls and then young women, you learn very quickly how to manage it yourself. And so as you were saying, Chris, when I have a lot of clients who've come to me recently who have hit like the perimenopause, menopause stage, who at that point they've gone, I'm not coping anymore, and have then gotten that diagnosis. But then you look back on their life and, all of the accommodations that they have in place and all the things that they've learned in managing all of that, so it's not this visible thing that you can see, means that when you do look at the diagnostic criteria on paper, you'd go, I can't see it, so you don't have it.
Plus it's also just some of the questions, and I kind of change them a little bit.
Yeah.
When there's a particular question in one of the ADHD tests that says, do you interrupt people when they're talking? And clients will often say no, and I'll go, all right, let me rephrase it. Are you itching to interrupt them when they talk? God, yes! And I'm like, you're ADHD tick. You know, I say you don't interrupt them because you know it's socially inappropriate.
Yeah.
But
Totally.
you're just going, just, I know what you want to say, just hurry up and get to it so I can move on. And they go, oh yeah. Or when you're sitting, you know, somewhere where you're expected to sit, are you itching to get, you know, do you get up? No. Do you want to get up? Yes. And so I'm mucking around under the table with my hands and tapping my feet. So you don't get up, but you want to get up. So I think some of these questionnaires probably need to be modified somewhat. You know, to suit what we know as social masking. Really.
Yeah, that's it. Finding those self-developed strategies that work in most situations for a lot of people, and then when things get too complex or too challenging, and that's when things can sometimes fall apart for some people. I think there's also a lot of misinformation out there though. Like, I don't use TikTok, but every now and then my algorithm on Instagram will take me to sort of therapy reels, you know, that whole space. And whether it's, you know, therapists or just, you know, people talking about their lived experiences, but speaking towards, you know, this is a sign of this and this is a symptom of this.
It's a worry.
Knowing a bit about it, the bullshit meter kind of starts to tick over a lot of the time, and I think that can be quite dangerous, because with a lot of these things, people do experiencing challenges with, you know, that align with some of these symptoms and criteria at some points in their life. But self-diagnosis can be really difficult, and finding the right professional to help you. Some aren't the right people to help you, you know, it's about finding the right person. But I think that is a bit of a danger in our world now, where most young people get their medical information off social media as opposed to the internet or medical professionals.
Well, I think I was reading an article that said there's an organisation that is starting to do psychology therapy by SMS. You know, so that's the TikTok of therapy to me. You know, first of all, for us, we'd like to see you face to face. If we can't because you're not here or you're sick, we want to see your video chatting. Then if we can't do that, phone is next, which we hate. Can you imagine if we went to SMS? It'd be like, are you kidding me? First of all, guys, it would be slow with me because I'd be stabbing the phone, and that's my idea of sending a message. But these guys might be a lot faster than me.
There would be a lot of typos as I'm trying to quickly type something, and you'd have to decipher it somehow.
But the fact that that is actually a service, that's the TikTok of it. And I think sometimes, you know, people, Chris, that are relying on the TikTok psychology, I'm not saying TikTok is useless and there's not some pretty legit, decent information out there, because there is. But there's a lot of superficial, and it easily, if you've got 15 to 30 seconds, it can be absolutely misinterpreted.
There's so much context that gets missed out.
Absolutely.
And if you're looking for engagement, then the kind of content you're going to put in your video is something that everyone feels like they can relate to. So you'll say that this is a sign that you might be an ADHDer, and then you will say something that's going to connect with the most
majority
people possible.
Of people.
And I think that that's sort of maybe one of the areas where the over self-diagnosis could be stemming from.
What you're saying, Hugh, is I kind of tell people, well, you're lucky because every ADHD is a really lovely person.
I'm sure they are.
No, but you're right. We have to be mindful that we don't sift through information, searching for information that fits our own belief system.
But again, going back to the fact that GPs next year will have hopefully
the well-trained ones.
The well-trained
ones that are going to do the training courses in the next few months, which is fantastic.
Having access to that, so that even if you do have all of this information, rather than waiting and spending a lot of money, but waiting however long a psychiatrist waitlist is to get a diagnosis or be told that actually no, it's not ADHD, having GPs available to be able to do that and help with a diagnosis process, I think is really positive.
But I was talking to one of the GPs, and we're going to try to twist his arm to come and do one of these with us. So we'll wait until then, Kevin.
We'll cut that out.
No, I haven't said his surname. And one of the things he said, which resonates with all of us, is that it's not enough just to prescribe medication to someone. You really should be seeing a psychologist to be looking at skills. You know, it's not just pills, it's skills as well. And that's super, super important. I think we do that in the pain arena as a matter of fact. You know, people come to us taking pain medication, but then we run pain programs to skill them up in techniques that don't just rely on take this drug, you'll be right. And I think the ADHD arena is the same because it's for life.
Yeah.
It's not like it's suddenly in 3 years' time you're going to be cured. You're neurodivergent and that's it. So, you know, taking some medication, it might take the edge off. You're able to think a little bit more clearly. The world settles a little bit more, but you're still going to be just as sensitive. You know, you're still going to be this, you're still going to be that, and you need skills how to deal with it. And that's the super important stuff. So we'll be running that next year. There'll be lots of anxiety and programs that relate to ADHD. And some of them, we run anxiety programs, but they'll be overlapping with the ADHD as well. So yeah, we're looking forward to that. It'll be like herding cats.
Yeah.
Some of us will have a lot of fun doing it. We'll be sending in Hugh wielding a whip.
Yeah. Hugh will be our timekeeper to keep us on track.
The rest of us will be coming in with lots of chocolates to
Yep.
try to get you going a little bit more. And someone said to me, oh, that sounds cool, I can't wait, but if there's 10 of us, you know there'll be about at least 15 conversations. And I went, yep, I know there will be.
We can work with that.
We can work with that, you know. And look, and I have to say that I've actually talked to clients over the last number of years with ADHD, and I said, would you give your ADHD up? 75% said no. 25% said absolutely, but 75% no. They said no, there's some things that it sucks, but Jesus, it's a bit of a superpower in other stuff. No, I'm not going to.
Yeah.
Some people choose to take medication, other people say, I'm never going to take medication. I know how to deal with it because I've been dealing with it for 60 years. And that's good too. So we have a whole plethora. What I don't want to happen is one of my clients told me they took their 5-year-old to the paediatrician and she said, oh yes, he does have ADHD, but so does he and his wife. We should start medicating. And this client is an educator and he said, absolutely not. His brain's still developing. Let's just see where he lands before we start talking medication. I thought, who the hell wants to medicate a 5-year-old?
Yeah.
A surprising number of people.
I know, that's a bit too young.
Yeah. Well, hopefully GPs who do the training will know better.
Will not be. Look, are there some kids that are 5 that should be medicated? I've seen them, you know, like climbing curtains and destroying houses, possibly. But your average 5-year-old doesn't need to be medicated.
No.
All right. So if you like us, please like and subscribe, and give us a call. Come down, join one of our programs. Come and see us individually if you want. Even touch base to go, hey, I'd rather see you and see if I'm ADHD, and then if you say I am, then I'll go see a GP.
Yeah.
So, thank you, Tim. Thanks, Chris, Hugh, Maria, Hannah.
Cheers.